In Brazil, family nursing scholars established a clinic for family research and intervention. The Comprehensive Clinic for Family Research and Intervention, affiliated with the Laboratory of Studies and Research on Family Intervention at the Universidade Federal de Mato Grosso do Sul, was established in 2016 in Mato Grosso do Sul state in Midwest Brazil. The clinic assists families of children and adolescents experiencing chronic health conditions requiring complex care, including syndromes, psychiatric and mental health disorders, and neonates with neurological sequelae. At the clinic, family interventions are oriented by a theoretical framework developed by Marchetti, with additional input from symbolic interactionism, family resilience, family vulnerability by Pettengill, and the cognitive family assessment and intervention models. The clinic is coordinated by Angélica Marchetti, professor and PhD from Federal University of Mato Grosso do Sul, Brazil, with other teaching members as collaborators, and with the collaboration of Miriam Mandetta, professor and PhD from the Federal University of São Paulo. Now, we will present one of the many works that are developed at the clinic, which has as a title, Interventions Promoting Resilience Among Families, Managing Children with Chronic Health Conditions in Brazil. Although technological advances have contributed to increase survival rates in early age, the growing number of children with chronic health conditions requiring complex care has overburdened families with new demands and challenges. At a multidisciplinary clinic for family intervention and research, operating at the Federal University of Mato Grosso do Sul in Brazil since 2015, we have provided care to these families in order to strengthen them to face situations of child illness, as well as to manage conflicts arising amid this experience and perceive themselves as self-effective in the care of children and in other family demands. The Family Intervention Program guides the interventions implemented with the families. We investigated how families attributed meaning to the interventions offered and how, in their views, these approaches have proved useful. The objective of this work was to identify the interventions regarded as most useful by the participating families. As a method, in this descriptive, qualitative study, the theoretical framework underlying the Family Intervention Program guided the process of elucidating the experiences of these families. Secondary analysis was performed on data collected from families cared for in 2016 to 2019. The study was approved by the institution's Ethics Research Committee, and the qualitative content analysis was employed for data interpretation. As a result, the analysis of interviews conducted with 25 families revealed the following interventions to have been regarded as most useful: listening to families about their experience with and management of the disease, encouraging families to make decisions, and providing relevant information. For the first one, listening to the family's experience and management of disease, we could see that for the family, this represents having its suffering and history recognized by the professional, having an opportunity to discuss ideas and share emotions. Family members can tell their stories, share family moments, and establish bonds of trust, a space to reveal feelings. The second intervention, encouraging the family to make decisions, it involves being praised for efforts and supported in their decisions, so the family feels helped, defended, cared for, and respected. And the last one, being provided with information. The family can ask questions without feeling judged. So all of the interventions showed that the family felt that its information needs were met, they became empowered to fight for rights, and they felt capable of seeking new manners of acting, as well as manage relationships and family crises brought about by the experience of suffering. The interventions also showed increased role flexibility in sharing of emotions, as well as increased tolerance for individual differences and more open communication with a potential for growing as a family. As a conclusion, we could see that aspects held as highly relevant by the families included embracement and dialogue with healthcare team members, which allow them to feel welcomed, understood in their demands, and encouraged to act in situations faced in the daily management of children with chronic health conditions.